Tim, Stephanie, as you can see, it's still an active scene behind me with these healthcare workers still holding the picket line. Remember, that strike started at 6 a.m. today. Now, Providence says that their operations are still running smoothly despite only around 10% of their union-represented workers coming into work today, with the rest of them striking for better wages, better staffing, for better patient life security.
We need to start putting decisions back in doctors' hands and not corporate executives.
Providence healthcare workers, this time including physicians, launched Oregon's biggest healthcare strike Friday, involving around 5,000 workers represented by the Oregon Nurses Association.
I'm out here with everybody else, to really advocate for patient safety. We can only do so much. We can only see so many people. And it really comes down to patient safety at the end of the day.
Doctors and nurses calling on Providence to not only provide competitive wages and benefits, but improve staffing and comply with the state's safe staffing laws, something physicians claim is not being done despite demands.
It makes you really angry and frustrated because we've been at the bargaining table, spelling these things out to them very clearly, what needs to be done, and even trying to provide solutions that they've all rejected.
But Providence says that's not true.
There have been requests from the different bargaining units for things that didn't end up in the law. That law, was a coalition of people. They've asked for those things to now get written into contracts.
Providence says they're highly committed to staffing, and even with a national shortage of doctors and nurses, they've made increases. But now with the strike, Providence had to bring in assistants to take care of patients.
We have medical directors, we have other hospitalists, we have independent medical staff physicians in place at St. Vincent's providing physician care for patients at St. Vincent's as we speak.
Providence says people can still come to their hospitals if needed, but longer wait times are to be expected. Physicians are only striking at St. Vincent and women's clinics, but nurses are holding the picket line at all 8 hospitals and all women's clinics too, leading some clinics to shut down. Providence blames the union for the impact to patients, but providers say,
I think it's insulting and it's also frustrating. Because that's our whole reason for being here is to, take care of our community. But, if we feel like it's not safe and not sustainable, that's not going to benefit our community in the long run.
So Providence also said for nurses specifically that if they decide they want to leave the strike and return to the workplace, they only have until 8 p.m. tonight to let Providence know that they've changed their mind. Also, I spoke with a doctor today who's on the bargaining team who says that they've sent proposals to Providence, but they're still waiting to hear back. Providence tells me that they're waiting till all their hospitals are stabilized before they can return to the table. Tim, Stephanie, back to you.
All right, Celine, a little sunshine on the strike line right now. Thanks very much.